I've been getting Botox probably for like 5 years. I didn't have to tell him where I wanted it to be fixed. It was more of like, make the faces. He saw exactly where I wanted, my sides, my front, and he just did it without me even having to let him know. After doing it with him, I had only 2 other people do my face. And one, I feel like I didn't feel it at all. I feel like it was probably one of the easiest I went through.
In about a week, it'll start working. When it starts to work, you might notice your brow feels a little bit heavy, and like when you put your mascara on, it might feel a little different. So like the saline that's in the Botox kind of settles into your brow like just when it starts to work. That can last for like a day or 2. Happens like 5% of the time. It may not happen, you might not notice it if it does. And then like 2 weeks of like fully settle out, but I think you should be good to go.
Botox is great, I gotta say.
Welcome back to the Dr. Mudgil Show. In this episode, we're going to be discussing the #1 cosmetic procedure I perform, Botox. Hey guys, I'm Dr. Mudgil. I'm a dermatologist and dermatopathologist based in New York City and Long Island. I'm a New York Times super doctor and a Castle Connolly top doctor. I practice cosmetic, medical, and surgical dermatology. Welcome to the Dr. Mudgil Show. Every day I see patients, I get asked, how can Botox help me? Do I need Botox? Am I too young to get Botox? The question really is, what is Botox? Botox is a neurotoxin. What that means is we inject it in very special ways into the muscles of the face to decrease wrinkles. The way that works is the muscles that are underneath the skin, when they move, they cause the skin above it to furrow. Repeatedly doing that over the course of years and years and years and years causes wrinkles to form. When you move the muscles of your forehead for a decade, you're going to get lines in your forehead. When you make an angry face for a decade or longer, you're going to get angry lines. When you squint your eyes looking into the sun or smiling, you'll get lines around your eyes. We use Botox to paralyze the muscles that cause those wrinkles. Now, Botox is a brand. There are a couple of other players out there, Xeomin and Dysport. But for the purposes of this video, I'm just going to lump them all under Botox. So now that you know a little bit about how Botox works, this is how we use it. So principally, we use Botox to treat lines on the upper part of the face. We use Botox to treat the 11s, which are right here between the eyes, forehead furrows, which are caused by these muscles, and smile lines, or lines that you use when you squint, and that's caused by these muscles. This muscle actually wraps all the way around the eye, but for the purposes of this video, and really where we inject Botox, is in the lateral part of that muscle. There are a couple of other areas that advanced injectors will also inject. I'll go into that in a minute. The 11s, which are the lines that are between the eyes, sort of those angry furrows that sometimes you'll see folks have, are caused principally by 3 muscles. There's a muscle between the eyes that we inject with Botox, and there's a muscle that extends above the eyes, which are these guys here, which we inject as well. The lines in the forehead are caused by this muscle here, which extends above the eyebrow into the scalp. For someone like myself who has this low cropped hair and sort of a never-ending forehead, we actually inject, or I inject Botox way up into my scalp. But for folks that have a more traditional hairline, we inject just to where the hairline meets the forehead. So for this muscle, just depending on where the patient is moving, so every time I inject Botox, I ask my patients to make expressions, so lift their brow up, so I can see exactly where the muscles are pulling from. That's where I want to inject, because it's the movement of that muscle that's causing the wrinkling of the overlying skin. So typically, I mean, this is different for every patient, but we'll put a few shots up here, a few shots out here. And again, it varies. Some patients need 6 shots, some patients need 10 shots. It all depends on where your muscles are moving. For the muscles around the eyes, which are the crow's feet, or the muscles that you make when you smile, we inject Botox around the eye. And typically that's 2 or 3 injections right around the eye. Now, advanced injectors can treat other parts of the face as well. So there's something called the bunny lines, which are the lines that you get right underneath your eye on the side of your nose when you scrunch up your face. We can inject some Botox in there to stop our patients from making lines there. In addition, sometimes when our patients pucker their lips, they get kind of like this orange peel appearance in their chin. So we can also inject a little bit of Botox in there to keep our patients from forming those lines. So that's it. That's how Botox works. That's where we inject it, and that's how we use it to treat wrinkles and to prevent wrinkles. If you've seen any of my other videos, you know that I'm a huge proponent of using Botox as a preventive anti-aging strategy. That means injecting it before you have lines at rest. Now that you know all about Botox, when we come back from the break, we're going to be performing Botox on my #1 patient, my wife. Stay tuned. So when I started my office about 10 years ago, Botox was something that was very popular, but it was almost like this secret procedure that people did. No one was really talking about it. Patients weren't really talking about it with their friends. It was predominantly women that were doing it at that time. And it's amazing, like fast forward to 10 years later, it's almost like, you know, getting your teeth cleaned at this point, getting Botox. People are a lot more open about discussing it. A lot of men are getting Botox. They're not shy to talk about themselves getting Botox. Women are talking about it with their friends. Sometimes they'll come in with their friends. Mothers and daughters come in together. It's something that's just, it has much less taboo now. Not that it ever needed to have taboo, but people are a lot more comfortable with the idea of Botox being used as part of a more global anti-aging strategy. And folks are just a lot more open to it because they know that it works and it really makes a difference. Okay, so you can see Vanita has very few or like zero lines at rest because we've been doing Botox for years to kind of keep her from getting lines at rest. And when she moves, like make an angry face and go up like this, you can see these dynamic lines. So the more you're making dynamic lines, the more your muscles are moving, those dynamic lines become lines at rest, and that's what wrinkles really are. So the key with Botox is doing the procedure before you have lines at rest. So in about a week or two, Vanita's forehead will be completely flush. There'll be no lines at all, and she won't be able to make lines, which is kind of the goal. A lot of folks are afraid when they get Botox that they're gonna have a frozen face and they're gonna look fake. The truth is, no one even really knows that you've had it done. It's hugely preventive, so you don't get those lines at rest, but your face is still expressive. You can still move. You just can't move that dramatically and create these deep lines. So it's been a while. I think it's been, what, 8 months or so since I think we've done your Botox. So Vanita's a bit overdue, but we're gonna top her off right now. Okay, so make an angry face. Good, relax. Having been married for, let's see, how long has it been, Vanita? Coming on 14 years. Oh, coming on 15 years.
Yeah. Good thing
I've seen that angry face a lot. Angry again. Good, relax. Angry again. Good, relax. You okay? Mm-hmm. Angry again. Good, relax. So the main risks when you do Botox are bruising and swelling. So I'm kind of concerned Vanita might get a little bruise there from the last injection site. So I just like to put pressure for about 30 seconds to keep a bruise from happening. It's the Mudgil Vulcan grip. It hurts the patient's forehead, but keeps them from getting a bruise, so. You all right? Mm-hmm. Okay, angry again? Good. Okay, open your eyes, take a look at the tip of my nose. You all right? Mm-hmm. Okay, tip of my nose. Good. You okay?
Yes.
I'm gonna go up like this. Okay?
Yeah.
So you get immediate pressure when you are worried a bruise is going to form is key. You're all right? Sorry. Okay,
Come up again like this. Good. Relax. Okay, last little bit, we're gonna do some around the eyes. Okay, smile. Good, relax. Okay?
Yes.
All right. Smile again. Okay, what's up? You good?
I'm good.
You're all set.
Thank you.
That's right.
Now that you've seen Botox, when we come back from the break, we're gonna sit down with my wife to hear a patient's perspective. So why did I want to be a doctor? God, that's it's kind of a loaded question. I was sort of forced into it. My mom had been grooming me since I was, I don't know, 3 or 4 years old. Basically told me that was my only option as a career choice, my brother and I. But the truth is, I really can't imagine doing anything else. It just seems just so natural. I always, even as a kid, I always loved doing something or helping somebody and like seeing that smile on their face. To me, that was just, it just felt good, it felt right. And you know, when you're a doctor, you're able to do that like 20, 30, 40, 50 times a day. And there's really no better feeling in the world. And you know, the scope of what I do so much stuff. I see kids, I see folks who are elderly. I do a lot of medical dermatology, helping people with their rashes and chronic skin conditions, but I also get to do a lot of fun stuff like cosmetic procedures and helping patients feel better about themselves. And you know, all of it is gratifying in its own unique way. But you know, doing that multiple times a day, it's just gratification upon gratification. And I'm not saying it's all roses. It's not, you know, of course, there are hard times and there are times where things don't go as you expected them to, or things go wrong. But by and large, you know, I can't imagine a better job in the world, or a job that would be better suited for me. I still get up every day, and I'm super psyched to get up in the morning and head to the office. And I still get that little chill in my bones when I'm the first one to open the office and click the lights on. I'm excited to be physically in the office spaces that I'm in, and I'm so excited when the first patient walks through the door, just as excited as I was 10 years ago. So I guess, I don't know, maybe it's in my blood, but I love what I do, and I can't imagine doing anything else but being a doctor. You think it would be easy for me to sit down with my wife and ask her about her experience with Botox, but she's a busy mother of 3, a busy dentist. It's impossible to pin her down. So I'm sitting with her in her office. I had to make an appointment to pin her down, so here we go. We're gonna hear all about her experience with Botox. Vanita, thank you so much for taking this time to sit down with me. You'd think it would be so easy, but we're both running around like crazy, so this is gonna be great. So you are my patient who I've done the most Botox on. It's been 15 plus years, I say, that we've been doing Botox, right?
Maybe longer.
Wow.
Yeah.
We've been married for 15 years.
Yeah.
That's right. So my patients ask me all sorts of questions about Botox, and you know, this very rarely is there an opportunity to sit down with someone who's had it and kind of get their feedback, especially long-term feedback over the course of 10, 15 years. So questions I get asked all the time are, first, does it hurt?
You know, I got Botox for the first time before my brother's wedding over 15 years ago. And I remember being petrified of the needle in my face and thinking it was going to be very painful. I think the first time I got it done, I was nervous and I felt more pain, but I think it was more nerves than the actual procedure itself. And since, you know, I've been getting it over the years, it's gotten less and less painful. You sort of get used to it. And your technique, and I'm not just saying this because you're my husband, is very gentle, and I don't feel any pain with the injections at all.
That's great. I mean, that's great for our patients to know, or my patients to know.
Yeah.
We actually use like a really, really fine needle. We use a finer needle now than we did when I first started doing your Botox. So the pain is pretty minimal, so I'm glad.
Yeah, it's minimal.
How long does it take for it to start working in your experience, and does it feel weird when it starts to work?
You know, I've never really noticed, maybe because I've been doing it for so many years, I never really noticed heavy lines on my face where I'm like, oh God, I gotta go in and get the Botox. So it's always been pretty I guess, steady with my lines. So I feel like within a day or two, I feel like my face still looks refreshed as it did the first time I ever got the Botox.
Has anyone ever noticed, like, hey, did you get Botox? Or?
So it's amazing. So I'm 45, soon to be 46 years old, and people comment all the time on how young my face looks and how young I look. And I'm sure some of it has to do with genetics. I'm not putting this all on Botox, but it's got to make some difference, right? 46 years old, and I have no lines at rest, no lines on my face, and I think it makes a huge difference.
Yeah, I mean, one of my pillars of my anti-aging strategy is preventive Botox, and you're the person that I've been preventing lines on for the longest, because the key really is the movement of the muscles are what make the lines form on the skin. And if you prevent those muscles from moving, you prevent the lines from forming. So with you, we started doing Botox, I guess it was 16, almost 17 years ago. And before you had any lines at rest. And, you know, through the decade of your 30s, you know, with 3 kids, you nursed all 3 kids. So you probably were only able to get Botox, say, like 6 times in that entire decade. But say Botox lasts for 6 months, for 3.5 years of that entire decade, you weren't making any wrinkles. That's kind of how it works. So I think initially when people started getting Botox, it was to treat wrinkles. It was, you know, they had wrinkles, they got Botox to soften those wrinkles. But the strategy has really changed over the years, and now it's very preventive. We use Botox before lines form at rest to keep our patients from getting lines. And I think, you know, your experience is really a testament to that. You know, you're nearly 46 years old and you don't have a single line at rest. And yes, genetics play a huge role, you know, healthy living, all that sort of stuff, eating right, preventing your skin from being exposed to toxins, all this stuff makes a huge difference. But, you know, Botox is a huge part of that.
Right.
Yeah. So a question I also get asked a lot is, you know, if I start getting Botox, do I always have to get Botox? Can I ever stop getting Botox? How often do I need to get Botox? So can you speak to that a little bit?
So I never really notice, like I said before, when I need to get Botox. Nobody's like, oh, those wrinkles are coming up, you need to come in for Botox, except for you, who reminds me to come in to go get it done. I think within a year, I get it done twice, maybe every 6 months. And still, I think I could go even longer. I think I could probably do every 8 months if I needed to, because I don't notice it on myself. And I feel like when you do administer the Botox at 6-month intervals, it really is preventive. Like, it's before those lines start, it's before people notice it. So twice a year, maybe once a year even.
Yeah, I think that's what most of my patients do.
Yeah.
Most of my patients will come in every 6 months. And the key again is to kind of get your reset or refill of Botox before it completely wears off. So you kind of have like sort of this steady stream. And you can even tell, like, when you look at Vanita in the camera, she still moves. Like, it's not that her face is frozen, like she's still expressive. So if you do it right, you don't have that frozen face, that frozen look. No one, like Vanita mentioned, no one ever even knows that she's had Botox. It's just that, oh, you look great, or you look refreshed, or you look like you just came back from vacation. And when you kind of do it on a steady schedule, like you mentioned, every 6 months or so, some patients need it more frequently, some patients need it less frequently, you can prevent lines from forming, which is the whole goal. So one of the things that I've realized doing this for nearly 10 years of my own practice is when we first started doing Botox, it was almost like a secret thing,
Right.
No one wanted to talk about it, even though people were doing it, and there was no like a taboo with an individual, but no one really wanted to talk about it with their friends or their family. What I'm noticing now is it's kind of out in the open, like, hey, I get Botox, or you should get Botox, or you'll love Botox, even when you're speaking with your friends or family. Do you notice that things have really kind of loosened up, like people are just much more willing to talk about it, and the taboo's kind of been lifted?
Yeah, I also think there's something to be said about transparency and being honest with what you do at home with your own skin and your regimen. So I am very open with my friends and family about getting Botox and how often I get the Botox, not just because it's you that's administering it and I feel like I look great, but it's like I want patients to know that it's not just a natural glow that I have, or I'm lucky and don't get lines. I do get a little bit of extra help from the doctor with Botox, and I think patients should know that it's a wonderful experience, and it makes my face look young, and I think everyone should get Botox.
Everyone should get Botox, and we were speaking about it earlier in the episode. Is it used to be like a secret thing where people would do it in private, but now folks come with their friends, or even, you know, your patients that you see, they come on the other side of the office and then, you know, you tell them, oh, you should get Botox, I'll get Botox. And, you know, we share a lot of patients for that very reason, because you're so open about it. Well, Vanita, I know you're so busy, and I really just want to thank you for the few minutes that you were able to give me.
Oh, stop. I'm not that busy. You're as busy.
I will see you at home. Right?
Yes, I look forward to that. That's the best part of my day.
So now that you've learned about Botox, you've seen Botox, and you've heard a patient's experience with Botox, you can understand why Botox is the #1 cosmetic procedure I perform. It works. If you're in the New York City area and would like to see me as a patient, you can contact me to make an appointment at either one of my offices. You can also find me on YouTube, Instagram, Facebook, and Twitter. Thank you so much for watching, and I'll see you next time.